Assalamu alaikum. We will discuss today basal ganglia, which is another important structure within the brain, and from its name, it's filled with ganglion or ganglia, which are the main neuronal cell body. And basal, it's located within the base or within the areas underneath.
Okay, our objectives for this lecture include, first of all, we have to know what is basal ganglia, what are the neuronal circuitry of basal ganglia, and two major circuits we will talk about in details, like the putamen and the caudate circuits. Also, we will have a few points about the functions of basal ganglia, what are the neurotransmitters for acting, and also I will give you a few clinical abnormalities related to basal ganglia lesions or diseases.
Okay, so what's basal ganglia? As we can see in this image, this is the brain, and we have the complex structure deeply in the cerebral hemisphere, which is called basal ganglia. These two bluish in color structures, okay, complex in shape, located on the two sides, are the basal ganglia. And also we have here, we can see the pale structures located adjacent to each basal ganglia are the thalami. Okay, we have thalamus on each side. Okay, and this is the basal ganglia. Okay, the basal ganglia, it's defined as a multinucleated subcortical structure located deeply within the cerebral hemisphere, and it's considered as an accessory motor pathway that help in controlling the motor movement together with the motor cortex, and it have multiple connections, neuronal connections, and inputs and outputs from and to the cerebral cortex. Okay, it's forming multiple neuronal pathways to assess its function. Okay. Okay, we say that basal ganglia is a multinucleated structure, so we need to know the nuclei within the basal ganglia. We can see this is the basal ganglia. This is the same structure we saw it in the previous lecture, but this is in a larger view. Okay, the first one, we can see this is the C-shaped yellowish color nucleus called caudate nucleus. Okay, this is the caudate nucleus. Then we have this yellowish circle called putamen nucleus, the second one, putamen nucleus, and beneath it we have the globus pallidus, the third nucleus called globus pallidus, this circle here. Okay, and also we have a small nucleus located just underneath the thalamus called subthalamic. Okay, subthalamic, so it is underneath the thalamus. And the last one, this extension here, the greenish in color, called substantia nigra, which it's extended slightly to the medulla oblongata. Okay, this is the substantia nigra. As we can see, this is the pons and this is the medulla oblongata here. So we have 5 main nuclei within the basal ganglia. We need to know the names and we need to memorize the names of these nuclei, because each of these nuclei has its own function, has its own neuronal connection, its own neurotransmitters, and there is pathological lesions or damage within each of these nuclei have a specific disorder and have specific signs and symptoms. Okay, so we need to know the names because they separated and have different function and role. Okay. Now, the basal ganglia, as we said, have input and output between different structures within the brain. Okay, and we have multiple connections, and they divide these connections into 2 types: 2 anatomical connections within the basal ganglia. One is that basal ganglia considered as a part of a big neuronal circuits, a big neuronal pathway. That is to say, it's a station for passing of neuronal circuits and neuronal fibers. Okay, for example, with the basal ganglia, with the cerebellum, with the cortex. Okay, this is the first circuit. Circuits, it's like a circuit of electricity، مثل الدائرة الكهربائية بنعرفها إنه هي تبدأ بمكان وتنتهي بنفس المكان. فممكن تكون بأول نوع من ال connection إنه البيزل ganglia is just a station, okay, for this multiple connection. But the second type of neuronal circuits, it's a real circuit. Here the basal ganglia nuclei have an interconnection between each other and with the cortex, okay. فهنا الدور رح يكون الأكبر للبيزل ganglia، هي مو فقط a station، لكن هنا البيزل ganglia أكو interneuronal connection between these different nuclei and then with the cortex to form a neuronal circuit and carry its function. So in this lecture we will focus on the second type of neuronal circuits. البيزل ganglia تعتبر هي العامل أو هي الميجر part with the cortex to form this circuit or this neuronal pathway. Of course, we have many circuits even within the basal ganglia between different nuclei, but we will focus on two major circuits. One called putamen, from its name, so the putamen nucleus involved in this circuit, and the second one called caudate circuit. So the caudate nucleus, one of its part of the circuits, one of the circuits part. Okay. So first of all, we'll talk about neuronal pathway of the putamen circuits, how it is start and how it's end. This circuit, okay, started from the motor cortex, mainly from the premotor and supplementary area, and also from the somatosensory area. تبدي عندنا الانبوتس، تبدي عندنا signals project from the cortex to pass to the basal ganglia, specifically to putamen nucleus. This is the first connection. Then the circuit continued to pass to another nucleus within the basal ganglia, which is the globus pallidus, okay, especially in the internal portion of the globus pallidus. Thereafter, it will pass to a very important part in the connection of the circuit, which is the thalamus, especially to the ventroanterior and ventrolateral nuclei or parts of the thalamus. And this circuit will end again in the motor cortex. فإذا انتهت السيركتس، بدأت بالموتور كورتكس وانتهت بالموتور كورتكس، okay? Especially in the premotor and supplementary cerebral areas. This is the first circuit, okay? So the main part of the circuit is the putamen. It will start in the cortex, okay? Then to the putamen, to the globus pallidus, then to the thalamus, and end again in the cerebral cortex. This is the first circuit. Okay, again, we'll repeat what we already said about this circuit. Okay, this is the motor cortex, and this is part of the somatosensory cortex. The projecting neuron started from here, passed to the putamen, okay, and bypassing the caudate, will not pass in the caudate, okay, and then projecting neurons pass to the globus pallidus, internal portion mainly. From here, it's continued to pass to the ventroanterior and ventrolateral parts or nuclei of the thalamus to back again to the motor cortex, okay? We say that we have another circuits within the basal ganglia. ممكن يصير عندنا connection بين البوتامين, the globus pallidus, and then to the substantia nigra and to subthalamic nucleus. This is another connection and another circuits تصير داخل الباسل ganglia. لكن هنا احنا نركز على البوتامين circuits, okay, اللي هي تعبر بالglobus pallidus and then to the thalamus. This is the first circuit. The second circuit, okay, we will mention the two circuits and then talk in details about the function of basal ganglia and these two circuits. Okay, caudate nucleus, we need to know that caudate nucleus, as we can see, this is the C-shaped red in color nucleus. It's, first of all, it's a big nucleus, okay, and it's extended horizontally and then end in a curved line, forming a C-shape like shape, okay. And because of that shape, it will pass and it will pass adjacent to many parts of the cortex, okay? It will lie adjacent to most of the loops, okay? As we can see, it's adjacent to frontal, to parietal, occipital, and even to temporal من يصير بيها الconvolution أو من يصير بيها الcurving, okay? So because of that, it can have an input projection from most of the cortex. ما راح يكون فقط من الموتور cortex. يكون من الموتور cortex، ممكن occipital, parietal، وحتى temporal أكو projecting neurons تذهب للباسل ganglia specifically to the caudate nucleus. فبداية السيركتس ما راح تكون فقط بالموتور cortex، لكن من multiple projecting sites من all most of the cerebral cortex. Okay, this is the difference between the caudate and putamen nucleus and circuits. So it will start from the cerebral cortex. Okay, we will not specify the site because it will take projection from most of the cortex, okay, because of its extending shape. Then pass to the caudate nucleus, okay, so it's called caudate circuits. And then it will pass again to the internal portion of a globus pallidus. Okay, this is the same as in putamen. And also from there, it will pass to the relay nuclei in the ventroanterior and ventrolateral part of the thalamus to pass again to the cerebral cortex. And here specifically, it will pass to the motor or the frontal lobe, specifically to the prefrontal, premotor, supplementary motor areas of the cortex. فالعودة مالتها راح تكون specifically to the motor cortex. Okay. Again, this is the motor cortex. Okay. This is the somatosensory cortex. Okay, and we have another projecting parts from most of the cortex in this area. So the whole cortex will assist in these projecting neurons, okay, in the caudate circuits, pass to the caudate, okay, and then to the globus pallidus. But we can see also it can pass to putamen and then to globus pallidus. هذه other parts من other circuits between the nuclei, okay. لكن الميجر part هي من الكوديت تذهب إلى globus pallidus and then to the ventroanterior ventrolateral nuclei of the thalamus to pass thereafter again to most of the motor cortex, including the premotor, supplementary, and prefrontal. Okay, prefrontal, it's a part of the frontal lobe, and it's have a specific function and a specific role in thinking and cognitive role. Okay, in thinking, how we can think. And in cognition function and in behavior, cerebral prefrontal. Okay, so this will give an idea that caudate circuits and caudate nucleus not have a role only in motor helping or motor controlling system, but also have a role in cognition and in thinking and in behavior. Okay, not only in motor controlling system. Okay, so the caudate nucleus plays a major role in the cognitive process or in the cognitive control of motor activity. Okay, the term cognition means that the thinking process. Okay, it's the thinking process of brain that use the sensory inputs اللي نستقبلها وأيضا the information that already stored in memory حتى نسوي cognitive motor function. Okay. معظم الحركات اللي احنا نسويها والموفمنت تحتاج الى thinking process، تحتاج انه احنا نسوي لها memorization داخل البريفرونتال لوب حتى نعرف شلون نسوي هذه الموفمنت. So most of our motor actions occurs as a consequence of thoughts. Okay, افكار متعدده ومترتبه داخل the prefrontal lobe in mind. Okay, and the process of gaining this information بشكل consequence ونسويها بشكل thinking حتى نسوي motor action نسميها بالcognitive control of motor activity. من المسؤول عن cognitive control of motor activity هي الcaudate nucleus بمساعدة الcaudate circuits. Okay. Okay, now we will just discuss the function of basal ganglia. It's a complicated function, okay, but we will try to make it easy for you. Okay, it's important to assess in maintaining a timing and scaling of a specific movement. Okay, each movement, when we perform a movement, okay, or motor action, the basal ganglia are going to help control that movement by telling how rapidly movement need to be. شلون نقدر نسوي movement، هل هي rapid هل هي slow movement، وأيضا نسوي controlling to the size of movement. It's going to scale the movement, going to smooth the movement. Okay، تسوي لها adjustment حتى تطلع بالطريقة المناسبة حسب نوع الموفمنت وحسب نوع السبجكت أو الشيء اللي نسويه بالmovement. Example, for example, a person, for example, when he wants to write a letter, for example, a letter A, he will write a letter A in a specific time. Okay, هو يعرف راح يسوي له writing بطريقة slow or rapid. Okay, in a proper time، يجهز time إلها. وثانيا يعرف يكتبها وين. مثلا هو راح يكتبها على piece of paper، راح يعرف إنه لازم يكتبها بspecific size. راح يكتبها على for example checkboard or blackboard يحتاج إنه يكبر السايز. زين، هل راح يكتبها small letter، راح يكتبها capital letter. فإذا هذه السموثنس و specific texture of the movement اللي تحتاج thinking تحتاج controlling وscaling تسويها عندنا البيزل جانجليا. So البيزل جانجليا تهتم بالتايمينج وتهتم بالسايز وتهتم بالسكيلينج of movements. هذه نحتاجها بالبيزل جانجليا. Okay. Okay. Give another example. Okay. An example of the basal ganglia function is the writing of letters in alphabet. Okay. When one asks us to write the letters in alphabets, okay, بطريقة تسلسلية بالعربي أو بالإنجليزي، هنا راح تشتغل البيزل جانجليا حتى تسوي scaling وconsequence وحتى نعرف شلون نكتبها بطريقة مرتبة. فلما البيشنت يكون عنده يعني when we ask someone who have damage or destruction in basal ganglia، هنا البيشنت شو راح يجي يكتب؟ راح يكتب اولا in impaired writing، راح يكون عنده scaling للرايتنج فراح يكتبها بشكل مبعثر و not proper، يشبه الشخص اللي الطفل الصغير اللي استوى مبلش الكتابه. اوكي، يعني استوى معلمين يكتب، شلون يكتب الطفل اول ما يتعلم الكتابه؟ راح تكون طريقه مبعثره، الاحرف مثلا مو بتكون بدائره، مثلا اذا بيها دائره ما تكون عدله، فاذا كانه يتعلم اول مره، لان السكيلينج والتايمينج للكتابه صار بي امبيرمنت. اوكي، صار بي امبيرمنت، فهذا الفانكشن اوف بيزل جانجليا. اوكي، طبعا بيزل جانجليا مو فقط تعنى بالرايتنج، مو فقط بالكتابه، also other functions تحتاج الى تايمينج وسكيلينج وخلينا نقول احترافيه اثناء عملها. For example when you want to cut a paper with a scissor، هذه عمليه تحتاج الى سكيل، تحتاج الى بالانس، تحتاج الى كنترول، فهاي تقدم لنا اياها البيزل جانجليا حتى نسوي cutting properly. اوكي، هنا من nails، اوكي، تقليم الاظافر نفس الشيء، تحتاج الى curving، تحتاج الى scale، تهيئ لنا اياها البيزل جانجليا. Another examples for example shooting a basketball through a hoop، هاي تحتاج الى specific motor function، passing a football and throwing a baseball and so on. فهذه الموفمنت كلها تحتاج الى proper timing and proper scaling. Okay. Now basal ganglia to these circuits to work، okay، هذه السيركت اللي حكينا عليها حتى تشتغل تحتاج إلى transmitters، تحتاج إلى chemicals secreted in certain parts to act properly، okay, and to tell the cortex that this movement is need to be slowed down, need to be inhibited, or need to be excited. Okay, these actions done by the action and by the secretion of specific transmitters or neurotransmitters. We have many types of neurotransmitters. First of all is the dopamine. Dopamine is secreted in the pathway from the substantia nigra to caudate and putamen nucleus. Of course, dopamine is an inhibitory neurotransmitter. Second is the GABA. GABA, this is from the caudate and putamen to globus pallidus. احنا قلنا انه عندنا interior circuits داخل interconnection circuits داخل النيوكلياي، بين النيوكلياي to each other، فهنا يصير عندنا عملية الإفراز للtransmitters. So it's from the caudate, putamen to globus pallidus and to substantia nigra. This is inhibitory again. We have the acetylcholine, already you know acetylcholine. This is secreted from the cortex to caudate بالpathway الماشي من الcortex to caudate nucleus and putamen. This is an excitatory one, so we excitation للfunction. And we have another multiple general neurotransmitter secreted in the pathways with the brainstem, like norepinephrine, serotonin, enkephalin, enkephalin, and several other neurotransmitters. And we have the glutamate, which is very important neurotransmitter, in different pathways will be secreted, and this is again an excitatory one. Okay, these are the neurotransmitters. Okay, I will give you some clinical abnormalities and a few notes about clinical signs you will hear and face in the subsequent years, and you need to know a few points about each. Okay, first of all, of course there are abnormalities within the basal ganglia. Okay, and here you will remember my first words in this lecture. I told you that we need to separate and we need to memorize the names of the nuclei within the basal ganglia. For that reason, because each nucleus, as we said, if it is damaged, it will cause a specific sign. We'll start by the first one, which is the caudate nucleus. When there is a damage to the caudate nucleus, we will have a disorder, okay, and there is a syndrome called Huntington disease, okay. One of its signs you need to know, it's called chorea, okay. Chorea It comes from the Greek word dance. Chorea means dance. This is an abnormal movement and it is involuntary movement. That's to say the patient cannot control it. It will pass spontaneously. راح تصير عند البيشنت without voluntary control. ما يقدر يسيطر عليها ولا يوقفها. And it is characterized by brief, abrupt, irregular, unpredictable, non-stereotyped movements. Brief, okay, brief بسرعة تنتهي. Abrupt, suddenly start. Irregular, فشي ما متناغم ما مترتب. Non-stereotyped نفس الشيء ما مترتبة. Unpredictable, تبدأ من وحدها بأي وقت كان. Unpredictable, okay, and this is occurred because of a lesion within the caudate nucleus. You can see in this image, okay, it's a dance-like movement. You can see here a dance-like movement وتكون non-stereotyped. مرة بهذه الإيد، مرة بهذه الإيد، هذه الإيد يصير بها extension، هذه يصير بها flexion، نفس الشيء هنا، فإذا هي non-stereotyped regular movement, okay، لكن تكون قصيرة brief, okay, and I will show you this video for chorea, sorry. Okay. You notice the movement in his shoulder. Okay, I will repeat again. Just focus on the shoulders of the patient, how he had a brief dance-like movement. Okay, again. Okay, here. Yes, this is the chorea. Okay, another movement called epitosis. Okay, epitosis. هذه تختلف عن الكوريا. أول شيء الابيتوسيس تصير because of damage to globus pallidus. globus pallidus in nucleus. Okay, هذه تكون أول شيء slow. ما تكون rapid. It's also involuntary, not under control of the patient. It's convoluted, writhing. هي تكون مموجة ويعني مثل الموجة تكون يعني بيها يعني curving or موجات convoluted. Okay. وعادة تصير بالديستال parts بالفingers بالhands ممكن تصير بالtoes and feet. Okay, and even in arms, legs, neck and tongue. So any distal parts ممكن يصير به الابيتوسيس. Okay, وقلنا هي due to lesion of the globus pallidus. Okay, and I have a short video for you. This is an example of this convoluted movement. As you can see, it is writhing like مموجة. Okay, وتكون slow. أهم شيء إنها تكون slow ما تكون rapid. Okay, حتى نقدر نفرقها عن الكوريا. Okay, of course you don't need to we will not ask you in this year to tell us how chorea occur or to differentiate between chorea and epitosis in videos. No, we will just want you to know where is the lesion when we have chorea and where is the lesion when we have epitosis, for example. Okay, هاي على الأقل أشياء تحتاجون تعرفوها، ولكن هذه الفيديوز خلينا نقول إنه هي فقط للإطلاع لكم حتى مستقبلا تكون عندكم فكرة شنو يعني chorea وشنو يعني epitosis وشنو يعني tremor. Okay, مثلا Hemipallismus. طبعا هي Hemipallismus. هيمي معناها عادة تصير بنصف من البادي أو بجهة واحدة، لكن ممكن مرات تصير باليزمس يعني ممكن بأي جهة من البادي، مو شرط هيمي، مو شرط بجهة واحدة. أوكي، ومن اسمها باليزمس هذه كلمة جاية من باليستيك موفمنت. باليستيك هي الموفمنت الأجريسيف يسووها مرات بالرياضة، يحركون حركات باليستيك تكون شوية أجريسيف، فجاي الاسم منها. It's a flailing ballistic undesired movement of the limbs. هو ما يريد يسويها. It's involuntary وتكون عادة شوية aggressive وأيضا تكون brief. Okay, and this is occurred because of a lesion of subthalamic nucleus. من تنضرب subthalamic nucleus البيشنت راح يصير عنده واحدة من الساينات، هي واحدة من الساينز يصير عنده Hemipallismus. Okay. And this is an example of Hemipallismus. Okay, it's one side of the body. As you can see, it's an aggressive movement. مرات تكون طبعا مو هذه minor Hemipallismus، فشي بسيط ممكن يصير more aggressive. Okay, okay, this is the ballistic or the Hemipallismus movement. Okay. Okay, the last part is lesion of substantia nigra. Okay, substantia nigra, we say it's important in nucleus and where the dopamine is secreted. So when you have damage in the basal ganglia, we will have a lesser amount of dopamine, impairment in secretion of dopamine, neurotransmitter. فالدopamine is an inhibitory as we say. فراح يغلب شغل الاستالكولين. المفروض احنا عندنا فد بالانس بين الاكشن اند سكريشن اوف دوبامين والاستالكولين. اوكي، من يصير عندنا decreasing in the dopamine level راح يصير عندنا زياده بالاستالكولين level، فيصير عندنا excitation و more excitation and excitatory function تغلب على inhibitory function، فما يصير عندنا بالانس، فتبتدي تطلع عندنا اعراض مهمه بمرض يسمونه باركنسون ديزيز. اوكي، Parkinson's disease هذا because of له اسم ثاني يسمونه paralysis agitans، هذا يصير because of damage to substantia nigra، وبالتالي we lose the dopamine secreting nerve fibers اللي المفروض توصل للكوديت and putamen، وبالتالي يصير عنده signs and symptoms because of excess of acetylcholine and less of dopamine، فيعالجون البيشنت ينطونه دوبامين بطريقه معينه. اوكي كتريتمنت. طبعا هو عنده في 3 important signs دائما يشخصون اعتمادا على هذه الساينز. اولا rigidity. rigidity شنو معناها؟ معناها طبعا احنا سبق ان ذكرنا شنو يعني التون، right? And we say that the tone is the stretch of the resistance to stretch of muscle on passive يعني passive stretch of muscle at rest، ما نحركها. فلما نجي نسوي التون assessment، شلون نسوي التون assessment؟ نبدي نحرك multiple joints of the body. اوكي، نسوي فد movement for example at the elbow نسوي flexion و extension حتى نشوف ايش قد عندنا stretch و resistance داخل هذه الجوينت. the same مثلا بالرست، نبدي نحرك الرست ونشوف الريزيستنس مالتنا. اهل الباركنسون ديزيز يصير عندهم زياده بالتون، يصير عندهم هايبرتونيا، ويصير عندهم ايضا rigidity اللي هي زياده بالتون، بحيث احنا لما نجي نحرك الجوينت راح يصير عندنا نحس باكثر من مينيمال اكثر من مينيمال ريزيستنس، راح نحس مقاومه كبيره هوايه خلال الرست، فهذه نسميها rigidity. اوكي، وطبعا اكو انواع للريجيديتي لكن راح نعطيكم اكزامبل عليها بصوره. اوكي، شلون يعني نشوف الريجيديتي. هذا هنا الفيزيشن او الاكزامينر يحاول يسوي يشوف التون اوف ذا elbow جوينت، فيحاول يسوي فليكشن واكستنشن. اوكي، انتم بالبيت تقدرون تسوون اسسمنت هسه لاحد افراد عائلتكم، تسوون فليكشن واكستنشن وتشوفون النورمال تون، وتشوفون بعدين هذا الفيديو تشوفوا شنو يحس وشوفوا شنو اللي صار اثناء الاسسمنت. اوكي، سي اكو عندنا ريزيستنس عنيفه يسموها ريجيديتي. اوكي، وهذا النوع يسمونه كوغويل ريجيديتي. اعيد لكم، كوغويل اللي هي العجله المسننه. اوكي، فعبالك العجله المسننه على كيفها تتحرك، ماكو سموثنس، ماكو سموثنس وانا اسوي فليكشن او يعني اسوي فليكشن وارجع الايد من اسوي فليكشن. اوكي، طبعا هي مينلي اون فليكشن نوت اون اكستنشن. اوكي، اجين اللي يحب يعيد الفيديو موجود يمكم. اوكي، شوفوا الريزيستنس اللي صارت، فهذه هايبرتونيا اول ساين تصير. another important sign and symptom طبعا تعتبر هي الانفولنتري ترامر. يصير عندهم ترامر اللي هي الانفولنتري موفمنت تصير عند البيشنت، هم من انواع الانفولنتري موفمنت. وعاده اهل الباركنسون يصير عندهم resting ترامر، يعني at rest، هو قاعد ما يسوي اكشن، قاعد يصير عنده الترامر وخصوصا بالهاند. هسه نشوف عندنا الفيديو. this is the resting tremor، وعاده يكون كورس ترامر فريكونسي مالته قليله. اوكي، طبعا هي اكو انواع للترامر بس هذا عندنا يسموه resting tremor. another important sign in diagnosis of Parkinson's disease. Okay, again this is the resting tremor. Good. And the last sign and symptom is the difficulty in initiating movement. يصير عنده slowness بالmovement، يسمونها hypokinesia ومرات حتى akinesia، complete absence of movement. وهذا ممكن نشوفها على البيشنت اللي عنده باركنسون، يصير عنده slowness of movement of the muscles of facial expression، يصير عنده expressionless face، يعني mask face ما يقدر يحرك بيه، ما مبين انه قاعد يسوي حركات معينه بالفيس مالته. ممكن تبين ايضا خلال الموفمنت. اوكي، يصير عنده difficulty in initiation of movement، من يبدي يريد يمشي ويتحرك راح يصير عنده difficulty وسلونس. هذه علامه ثالثه مهمه من علامات الباركنسون. اوكي، هذا اكزامبل على الموفمنت. شوف شلون هنا قاعد يحاول يسوي initiation، it's very slow. اوكي، it's very slow. اوكي، not normal movement، يعني يحاول يسوي initiation وحتى اثناء الحركه عنده difficulty بالموفمنت. هذه نسميها hypokinesia ومرات akinesia، complete loss of motion. اوكي، like this.
Okay, in summary, we talked about basal ganglia. We said it's one of the important subcortical structures. It's a multinucleated structure located deeply, occupying a large portion of the interior region of both cerebral hemispheres. The basal ganglia receives most of their inputs, as we said, from the cerebral cortex, and also through certain parts and structures will have most of their output back to the cortex through many circuits, as we said. We talked about the bottom-end circuit and the caudate circuits. We say that it acts by changing the time and scaling intensity, and scale the intensity of movement, and we said how this function occur. We see that you have also multiple types of neurotransmitters within the basal ganglia. Some are excitatory and some are inhibitory. And we also saw some clinical abnormalities related to each type or each nucleus within the basal ganglia. Thank you.